Welcome back. Spring is officially here, which means warmer weather, blooming flowers, and unfortunately, allergies. Lots of us get itchy or swollen. It makes you kind of swell up just talking about it, doesn't it? During this time of year, here to talk more about some ways we can make allergy season a little less irritating and painful is Dr. Sandy Feldman. Good morning to you.
Good morning.
So what specifically are we talking about today? We're talking about the seasonal allergies that really affect the eyes right now, right?
Yeah, exactly. So allergies can cause redness, swollen eyes, tearing. It can affect both eyes, and itching. That's one of the telltale signs.
And the statistic I saw is 20% of Americans suffer from this. I would think that's higher than that. It seems like everybody's got these things.
Well, it depends on if it's seasonal, including medicines, drug allergies, food allergies,
Sure.
dust, mold. There are so many different kinds of allergies, and at least 20%.
Yeah, right. Okay, and we'll stick with the seasonal right now. And you have some products back here, but it's not really about the products. It's about what you do to prevent this from happening. That's the key, right?
Exactly, because some people, their immune response kind of responds to normally harmless agents in the environment. So spring, everything's blooming, and some people, the pollens, grass, trees, flowers, they're allergic to because they produce little chemicals that then cause the eyes to water and the nose to run.
Okay, I was looking at this list of suggestions, and the first one is obvious. Don't go outside when the pollen's high.
That's right. Now, how do you know that?
Yeah.
You can check out the website, pollen.com. And so that can give you an idea, is it low, medium to high, or high risk? So you want to stay indoors, keep your air conditioner on or a HEPA filter going. And you have to remember to actually change the filters.
Yes.
It does no good if you don't change them.
Okay. Another one, and seems simple enough, wear sunglasses or eyeglasses, prescription eyeglasses.
That's right, because that will prevent the pollens from actually entering the eye. And if you normally wear contact lenses, your eyes are already irritated. Putting a foreign body in causes only more symptoms and more irritation. So you probably want to stop wearing contacts if your allergies are acting up.
And your business is in LASIK too, and that's not, I mean, you're not pushing it for everyone, but it is something to consider for folks who have allergies.
Exactly, because you'll have trouble. Many people don't like glasses because you lose your peripheral vision, and they're thick and heavy on your face, especially with allergies if you get a little sinus headache along with it.
Okay.
And so LASIK will just enable you to see without a foreign body in your eye.
If you're a good candidate for it, right? Now, some of these products back here, is there anything better than the other, or are they all pretty much the same?
Well, they all are slightly different. So the first thing is, if you have allergies, the best ones might be, if it's mild, some of the non-prescription ones are just antihistamines. But some other eye drops include antihistamines and cell stabilizers to prevent the release of the chemicals. You can also use teardrops. And if you put your teardrops in the refrigerator, the cold constricts the blood vessels, and it really soothes the itch. And it helps the dryness, which some of these other medicines, if you're taking some of these oral antihistamines, they'll dry you out.
I always like to ask doctors this question too. You see the Claritin and the Benadryl and the these are expensive products sometimes. Are the generics as good as these products in your estimation?
Well, the active ingredient in the generic is the same. They've undergone FDA testing, which says that it's equivalent, but sometimes the chemicals are sometimes slightly different, especially in eye drops where there's preservatives. So some are definitely as good, some maybe not so good.
You just have to try it and find out for yourself, right? Doctor,
Exactly.
Thank you very much for coming in. We appreciate it. Makes me blink just talking about this. We'll be right back with more of Good Morning San Diego right after this.